fantastic demonstration, fantastic solidarity building in Whips Cross, the best solidarity I've seen in years, beginning to emerge. And I think the only way we can go forward is if we build and support each other, solidarity, because we come into the NHS because we do care. We're working in a system, we're run by politicians who don't care, so we've got to stand up and ask our communities to defend us. So the last speaker is Candy Edwin from London, Keep Our NHS Public.
Yeah, the only thing really that I wanted to say is across London, it's not just happening here. You know that there are 9 casualty departments threatened across London, and from St Heliers to Chase Farm, across London, we're under attack. And I just think it's a fantastic demonstration today because we are sending a message, Maggie Thatcher, she got away with a lot of things. She never got rid of the NHS. She couldn't do it. And if Cameron thinks he can do it, he's got another thing coming. And really, I just wanted to tell you about some victories, because we are beginning to win, You'll have heard about Lewisham Hospital. Yeah. I mean, it's fantastic, isn't it? But what you may not know is that they haven't just stopped the casualty from closing. They've got a PFI deal in their district as well. They have forced the government to put more money into their health district. They are having their PFI deal bailed out. They're doing it quietly because they don't want other trusts to know. But they have won more money, and you can do it too. The Whittington Hospital this summer was threatened with huge cuts and a sell-off. They have completely withdrawn the plans. They have won. Hackney has had, like the rest of us, private companies running their out-of-hours service, a terrible company, Harmony. Last week, Harmony were kicked out of the out-of-hours service, and the GPs have won the contracts back. We can win. I think there's 2 things that we need to do. One is, Janet mentioned it, but I'll invite you to there's a special NHS workshop at this conference, United Resistance Conference, on the 19th of October. We need to learn from each other. How did they do it? Let's share the experience and make sure that, because you're at the front line here, the other thing is we have to stick together. And Manchester was a fantastic demonstration. At our meeting last night in London, we called for 2 things. You're at the front line here because they're attacking your pay, but now the government wants to do it to everybody. We said, why don't health workers demonstrate at the Department of Health next week on the same day that teachers are on strike, striking against the government? So there's an idea for people to discuss. And the other thing that we said is we can't let that fantastic demonstration in Manchester be the end. We need to spread that out, and so we're calling on the London unions to call a demonstration in London to unite all the campaigns. So good luck, and don't stop till you win.
NHS here to stay. Health cuts.
No way.
NHS.
Here to stay.
Health cuts.
No way.
NHS.
Here to stay.
Health cuts.
No way.
NHS.
Here to stay.
Who's NHS?
Our NHS.
Who's NHS?
Our NHS.
Who's NHS?
Our NHS.
Okay, thank you very much. Bye-bye.
Thank you for letting me speak. I'd like to be brief. I think this is an excellent demonstration of opposition to cuts, down bandings, privatisation, etc. And yesterday I got chucked out of Whips Cross. HR found me in the corridor giving leaflets out urging workers to vote in the indicative ballot so that they could take strike action against the down bandings and the cuts that are taking place there. I was given around 2 hours to loiter outside the restaurant and outside the shop to give my leaflets out, to try and build a momentum within the hospital so that we could have a united workers and community campaign in Whips Cross and hopefully spread that across East London. Because it's true, 50,000 people marched in Manchester to save the NHS, and there was outrage afterwards because it barely got a minute's mention on the national news. But the firefighters struck that week, and the teachers are going on strike next week. And that makes national news, and that makes regional news. Why does it do that? Because things stop and people take notice. And therefore, this ballot that is taking place at Whipps Cross, it's essential that we try and move the workforce across the whole of the trust to come out in sympathy and to reach out into the local community, into the businesses, into the schools that are all facing terrible austerity, and link up in one almighty roar to defend the NHS. I'd like to finish by saying there is no political party in this country calling for cancellation of PFI. And PFI is like a ghost, it's like a chain around our necks, drowning us. Therefore, we are calling in the Trade Union and Socialist Coalition for health campaigners to stand on the basis of cancelling PFI debt, because it's not our debt and we shouldn't have to pay it. Thank you.
Yeah.
As a health visitor. I just want to say something on behalf of the community health services here in Tower Hamlets. Thanks to the massive, fantastic savings efficiency plan, the health visiting team, the district nurses and the school nurses are being slashed. The numbers are already short on the ground already, and so they're going to be cutting numbers even by demoting staff. And it's not just staff that are being cut, it's the resources, the equipment, really everything, basically everything you can think of is being slashed to bits. And this is one of the poorest boroughs in the United Kingdom. It's also one of the youngest boroughs. We really need health visitors, you know. And we need the school nurses. We really need health visitors and school nurses and district nurses. I mean, who's going to go out and do this work without them? I mean, how can you slash it even further? Yeah, the kids will die. We will. Thank you, definitely, and they are dying, basically, so thank you.
Because we care, hashtag because we care.
Yeah.
Hashtag because we care.
We also just want to say, people with their private Bupa, private health schemes, they got knocked over on the road, they will be coming to an NHS hospital. They don't realise the significance of all the cuts that are being made on everybody's NHS system. As I say, they don't check you. Luckily, we're not in the USA. They don't check you first to see if you have your insurance policy paid and everything's fine. We have an NHS service that we're all proud of. You know, we're all so happy to say we work for the NHS, but when resources are being pulled so dramatically, and we're struggling to do our day-to-day basic work, it's actually really, really quite hard to carry on doing that work. You know, we all love the NHS, that's why we're all here, that's why we've all turned out. We want to really support this. But as I say, people with their private health schemes, they should really start looking at what's going on here, and they really need to start thinking about what the PFI really means. Because that is a huge amount of money that's being wasted from resources from the community. The community is a Cinderella service as it is, but things are being pulled even more. And, you know, as I say, we need to really stand up and fight for what we believe in. Thank you.
Hi,
thanks very much. My name's Jan Blake, I'm a retired health visitor and I'm a Newham resident. Hello. And I'm speaking today on behalf of the Newham Save Our NHS campaign. As you're probably aware, there's community campaigns in all of the boroughs supporting the hospitals, supporting the workers and defending the services. We're a group of health workers and residents, and we're opposed to all the attacks that are taking place on the NHS today, the reduction in budgets, the massive privatisation and the PFI scheme. We feel very, very strongly that we're all in this together, all of the East London boroughs. These problems are not just affecting Whipps, and they're not only going to affect Whipps. There's 6 hospitals affected by this PFI scheme, as well as the community services here in Tower Hamlets. It's important, as people have mentioned, there's over £2 million a week going out to pay for this PFI scheme. This is massive, and the management of this organisation are going to be looking for very big cuts in services to pay for this. Debts like this will not be met by one department at Whipps closing, or by the rebanding of nurses, or by reduction in nursing numbers, which is terrible enough as it is. If we look at West London, there's 4 A&Es threatened with closure in order to pay for their PFI scheme, and there's going to be, we can look for that in East London. I think we really welcome this protest and this opportunity to come together. I know there's people here from all the hospitals in East London and all the communities, all the boroughs. I think PFI is an awful deal for the NHS and the schools as well. And the government should be using its powers to renegotiate PFI. And that's perfectly possible. It was done for the banks, and it could be done for the hospitals. So what's important now is building a very big and a very well coordinated campaign across East London. In Newham, I have to admit, we're always the last to get organised. So if there's anybody here from Newham, if you have friends or colleagues living in Newham, if you want to, please do see me and get on our mailing list. We're having hopefully a big public meeting at the end of the month, and we'd like as many people there to support that and to continue the debate, to inform people and to continue the fight. Thank you.
Hey.
I'm now going to come.
Firstly, can I bring a message of solidarity on behalf of the people I represent, council workers in Tower Hamlets, and I'm very, very glad indeed that we've stood on this land belonging to the Trust, because a very simple message: this is not your hospital, this is our hospital. Yeah. It's not your NHS, it's our NHS. And we are going to stand together to defend our NHS. Yeah. And what we see tonight is a powerful display of unity. And it's important, because we have to say, we're not going to see you try and divide Whips Cross from Barts or the London or Newham. We are going to stand together as health workers and communities to defend all of our hospitals and all of our health workers. And that's important because there are many people who are trying to divide us. Jeremy Hunt, the Minister for Health, he says the main problem in the NHS is not cuts or closures, but supposedly women wearing the niqab. Now, we've been standing here, I don't know if you've seen that the major problem in this hospital is women wearing the niqab, but that's an attempt to divide.